My name is Don Tatalovich. I'm the owner of Cornerstone Dental Center here in Hayden. As far as why bone grafting is so important in restorative dentistry as well as in implant dentistry, if you think about the bone in your jaws as the supporting structure beneath your teeth, and then for an individual that has implants, that will be the supporting structure beneath those implants as well. We obviously need to have a good, strong, healthy bone in order to support teeth and implants. So for implant dentistry, one of the things that we consider is, do we have a deficiency of bone, and do we need to augment that with grafting? And so that would be something that we would be doing, a grafting procedure to increase the strength of maybe the quality or quantity of the bone we have. And what is bone grafting and why might one need that? So for someone that has a situation where a tooth has been taken out, it's missing, or we're looking at a tooth that needs to be taken out due to maybe it's a fractured tooth or a tooth that has an infection around it, you'll usually have bone loss associated with those things. As we obviously our plan would be to come back and replace that tooth, and so as we consider that replacement tooth, which would be an implant likely, we'll come back and we'll add graft material into that space in order to sometimes people use the term augment, or to increase the amount of bone available to support your future implant. What are some of the more common reasons that a patient might need bone grafting? So the most common is probably as we evaluate an area where we want to place an implant, we need to decide if there's enough available bone there in order to support that future implant. And so for somebody that's missing a tooth already and things have healed, we would evaluate that, and potential grafting, someone might use the term augmentation, that site might be augmented in order to support an implant. For somebody where we have a tooth but we've decided based on the health of the tooth that needs to be extracted, we'll take a look at, again, that site or that socket and evaluate that for bone quality and quantity. As we place our implant, we really want to make sure that there's as much bone as possible around that implant supporting it, so that there's good strength and health for the life of that implant. So when we start to talk about who might be a patient or a person who would benefit from bone grafting, and how do we determine that? And so as we initially sit down and evaluate during a consult appointment, evaluate again a site, or it might be, if the tooth is there, we might describe that as the socket of the tooth, the space that'll be there once that tooth is gone, and then really evaluating, maybe if you describe it as the width and the height of the bone there, as well as the quality of the bone, and as we evaluate that, will that be adequate to support that implant? And so oftentimes if someone has infection around a tooth, bone has been lost due to that infection. And so after that tooth is extracted, the socket we remove the infection, it's disinfected, and then we need to replace that lost tooth structure. So what kind of procedures do we offer here at Cornerstone Dental in relationship to bone grafting? For our office, as most of the time we're focused in relationship to grafting, we're focused on placing an implant in an area, a site where the tooth has already been lost, or we're planning on extracting a tooth. Really our procedures would revolve around the idea of socket preservation, where after that extracted tooth is taken out, we'll put graft material into that space to preserve the socket. Also, as we place implants, oftentimes immediate implants, we will fill in deficiencies in the socket or the space with graft material in order to make sure that we get good healing of the bone to support our implant. With a bone grafting procedure, what might that look like from a patient's perspective? So the initial appointment that we would have with a patient would be a consult. And so at that appointment, we really want to get our digital images, our radiographs or x-rays. We want to get possibly some scans of your mouth and the area that we'll be working in, as well as some photographs. A lot of times the aesthetics will rely a lot on facial features, and so we'll take some photographs sometimes to evaluate what our outcome will be. With that, then we need to decide, based on our radiographs and what we're seeing in someone's mouth, what bone is available to determine the need for a graft. After we've done that, we'll schedule a surgical appointment with you once we've decided with you on the course of treatment, and then at that surgical procedure, you'd go through the process of having a tooth extracted and the graft placed, and then we would see you for a follow-up appointment to assess healing and integration. How does modern technology help with the process of bone grafting? How does this make things more comfortable, more predictable for a patient? So with our initial consult, we'll sit down with the patient and we'll take some x-rays or radiographs of that area. We'll probably take some photos and some scans of the area to evaluate our goals and discuss with the patient what our ultimate goals are as far as replacing the tooth. After a tooth is taken out, we'll be able to graft that. Prior to us starting that procedure, though, we'll have an idea, due to our imaging techniques and due to the scanning and photographs, what we would expect throughout that surgical procedure. At that planning process, we'll then be able to decide, is this something that will follow a more traditional workflow where we'll extract a tooth and graft and allow things to heal and integrate, or will we be able to place that implant and the graft at the same time, allowing those to heal and integrate at the same time in more of an immediate placement process? What might be some misconceptions or some unknowns when it comes to bone grafting? Some questions that patients have asked me along the way. So a couple things that I've discussed with patients as we've discussed the need for bone grafting. What will the healing be like after bone grafting? Will it be different? Will it be painful? So for the surgical procedure, the process, we'll make sure that a patient's numb, we'll make sure they're comfortable, and then as that tooth is taken out, the socket is cleaned and the graft is placed, there will be a little additional time that will be needed in order to complete additional steps in the surgical procedure, but there won't be additional pain for that patient. Healing will we'll move along efficiently with the site, the same way we would expect with an extraction of a tooth. And so as we go through the process of planning and then making sure that procedure goes well for the patient efficiently, and then assessing for healing and monitoring after the fact, we wouldn't expect any additional pain or discomfort for that process for the patient. For patients that in the past might have been told that they're not a good candidate for implants, or that they need a particular procedure or should avoid a certain procedure, what would my advice to them be? So as I evaluate someone's teeth and mouth and gums, we really need to take a look at x-rays. We need to talk with the patient about their goals and really decide what treatment is best for the patient while we're discussing what possible treatments would be ideal or even possible for the patient. And so coming in to see us, having a discussion with us about what your goals are, and as we do that, we can evaluate, do you have an appropriate amount of bone quality and quantity, and if not, what procedures need to be pursued in order to overcome that.